Welcome to Bayou Time. I'm Jacob DeGate, and my guest today is Dr. Eric Brooks, who is the Region 3 Medical Director of the Office of Public Health. Doctor, thank you very much for joining us.
Thank you for having me.
Okay, first off, let me talk about your current role. Can you tell us, what exactly is the Regional Medical Director? What is your role as that?
So I work for Louisiana Department of Health, Office of Public Health. Our main office is in Thibodaux, but we serve all the Bayou River parishes. So our role is to assist in, say, medical special needs shelters for hurricane evacuations, the parish health units, sanitarian services, things like that. So it's really kind of broad-reaching as far as our services.
Okay, and how long have you been in that role, and what did you do before?
So before I took this position, I was emergency medicine trained, LSU, New Orleans for medical school, LSU, Baton Rouge for residency, practiced in the ER for the last 10 years or so. Recently took this position in March, taking over from Dr. Chip Riggins, who previously held this position.
Okay, and was there any, reason you decided to make the transition from, practicing every single day to this new role that you have?
I guess the biggest benefit is the hours, and the ER never shuts down. There's a lot of
true.
nights, a lot of weekends, a lot of holidays, and so it's been nice just having a more regular schedule. That's probably the biggest benefit.
Okay, and I guess being in the ER during the time that you were in, it was, I guess, right during the height of COVID. You were right there on the front lines of everything as it was breaking, in 2020.
It was. We were kind of in the trenches.
Okay, and can you tell us back, where we currently are? I've seen, just from casual observance, from at work at different places, more and more people recently have been out because of COVID. I myself had it again 2 months ago. So can you tell us what in this area, what is COVID doing?
So COVID in general is, we're in the midst of another spike. It's difficult to say for sure exactly what those numbers are, mainly because testing is not as well reported as it was in the beginning, when a lot of the testing was being done in the hospitals and clinics. Now, a lot of people just aren't testing. They're just assuming they have COVID or something like COVID and isolating or using a home COVID test and not reporting that positive result. But we do know that numbers are up.
Okay. And how about, the hospitalizations? Have those increased at all, or?
So in our region, the Bayou River Parishes region, ER visits for COVID or COVID-like illnesses have kind of plateaued, and hospitalizations have actually started to show a recent decrease. So even though there is a large spike right now, I don't think we're in the same kind of boat we were with Delta.
Okay. And what is the new, I guess, the variant that we're currently on?
So we're currently, the Omicron is the current kind of variant with a multitude of subvariants. BA.5 is currently likely the major subvariant we're experiencing, which is a very contagious variant.
And I guess to determine that, it's a little bit more of an extensive test that has to be conducted to where you not only know that you're positive, but you know what you're positive for.
Yeah, so that's going to require much more extensive testing, and they kind of do random samplings of cases to identify the major variants.
Okay, and now this variant that's currently spiking, how does it relate to the previous variants? Is it more dangerous, or, is it still, I guess, dangerous as the previous COVIDs were?
I think what we're seeing, kind of evidenced by the plateau in ER cases, by either decrease or plateau in hospitalizations, at least in our region, is a good chance it's not quite as severe an illness as Delta was when we compare variants. That, in combination with vaccines, with medications that can treat COVID, such as Paxlovid, things like that you can take at home, which may also further decrease the severity and risk for hospitalizations. I think overall, even though it's very prominent in our communities right now, we're not seeing as much death associated with it.
And I guess for the people out there, most people out there, you would think would either have been vaccinated or they've caught some variant either once or multiple times. I would probably say it's kind of, would it be rare for somebody to be completely, uh, without any protection, without any vaccine or previous infection?
I mean, I don't have any numbers exactly, but I would say it's probably extremely rare right now to find somebody who hasn't had either COVID itself or the vaccine.
And I guess if they would, those people would certainly be at the most risk.
Yes, absolutely.
Okay. And at vaccines, where are we right now? Is there, how many do we have out there that you can currently get, and is there any new ones that are coming?
There are. So currently there's 4 vaccines available. Of course, the Moderna and the Pfizer are the two that are recommended. That's the newer mRNA vaccines. And then the new kid on the block is going to be the Novavax vaccine. That's available for physicians and clinics to order, but is not available to administer yet, but we anticipate that will be very soon.
Okay, and is it any different type? I know you had the mRNA vaccines. You have different types. Is this all similar types of vaccine?
It's this one is very different in that the Pfizer and Moderna vaccine that were initially recommended were based on a newer technology and what they were referred to as mRNA vaccines. It may make people who were previously uncomfortable with receiving that type of vaccine more comfortable to know that Novavax vaccine is based on traditional vaccine technologies like you would have received in like the flu vaccine.
What is the current recommendation from CDC about who should receive vaccines? I know we've had, talks of boosters. Those have been recommended as well. What's the latest?
So the latest CDC recommendations, as far as primary series goes, is for everybody aged 6 months and older. Boosters being recommended for those 5 years and older. Important to note, the new vaccine that we just talked about, the Novavax vaccine, currently does not have any booster recommendations associated with it. But moving to the mRNA vaccines like Pfizer and Moderna that most people have received at this point, first booster is recommended after 5 months. Second booster for adults 50 and over, 4 months after the first booster. Those recommendations change for those that are moderately or severely immunocompromised. And I would recommend that patients who fall into that category talk to their doctors or refer to the CDC website for more information.
Okay. Now, COVID, of course, it was something new to us a couple of years ago. Another thing that is new to, I guess, the United States, it's seen reported in the news a lot, is something called monkeypox. For a lot of people out there, including me, I'm not too familiar with. Can you just give me a brief overview of what is that disease?
Yeah, so a little bit of background on monkeypox. It was first identified in the 1950s in a colony of monkeys, hence the name monkeypox. Although we don't know for sure that it lives just in monkeys. I think it lives a lot in endemic regions in Africa and rodents and other small animals. The first human case of monkeypox wasn't reported until the 1970s. It's in the same virus family, meaning it's very similar to smallpox. However, the symptoms associated with monkeypox are likely they're seeing much less severity and a much lower or very rarely fatal when contracted, although it may be extremely painful.
Okay. Now, when somebody would catch monkeypox, even if they can receive treatment, is this something that is like a lasting effect? Is something that they live with throughout treatment, or is something that can be cured once they catch it?
So currently, after contraction, symptoms have been lasting for around 2 to 4 weeks. And once the disease has run its course, from what we know, there shouldn't be any lasting effects from what we've been seeing.
And what are some of the first symptoms that are there to be recognized?
So after contraction of the disease, there's usually a latency of 1 to 3 days. And then there's a prodrome, meaning symptoms appearing prior to a rash. Those symptoms are usually flu-like. Fever, chills, headache, fatigue, muscle aches, swollen tender lymph nodes, things like that. So if you imagine you have the flu like most people do, that's kind of how you start feeling. And that's usually 1 to 3 days to a few days before the appearance of the rash. And the rash can appear anywhere on the body, and it's usually blister-like.
Okay, and how is it contracted?
So it's not contracted. It's not nearly as contagious as COVID. It still can be contracted or transmitted via close contact and large respiratory droplets, but that requires prolonged close contact. It's generally contracted with direct contact with infected body fluids, either direct contact with the sores or direct contact through clothing or bed linens.
And how long, I guess just, I know it is kind of a new thing in this area, but how long, does the, I guess, disease, is it capable of being, I guess, spread to other people? How long after contraction?
So after contact with an infected individual, if you have close contact and you've contracted it, we usually see the appearance of symptoms within a few days.
Okay, within a few days. Now, is that something, I know it's been a hot thing in around New York City. Has it moved to this area? Have we seen any in Louisiana, and is it spreading here?
So we have seen quite a few cases. It started mainly in Region 1 of the New Orleans area. The U.S. now has over about 4,000 cases, 4 to 5,000 cases, with 28 of those cases being identified in Louisiana and 1 case in the Bayou River parishes.
Okay, and what type of testing is done for it, and is that something that can be tested locally?
So it can be tested. There's wide availability of testing. So testing is fairly simple. It involves swabbing, and we generally swab several of the lesions and send those off to the lab with the results usually within a few days.
Okay, and as far as treatment of it, is there any specific treatment that has been developed, or is that still coming out?
So the good news that it is so closely related to smallpox. The vaccines that were developed for smallpox are effective against monkeypox. And so what we're doing at this point, given the limited number of vaccines available in our area, we're trying to target those that we know have been in contact or that we know have had high risk of contact in the last 14 days.
Okay, so those elderly people who are still, around when the smallpox vaccine was, recommended for everybody was getting it, that would cover, so those people should be good to go?
Yet to be determined. Very likely that vaccine effectiveness lasts for decades, but we don't know for sure yet. We'll keep a close eye on that.
All right, so I guess it would be any concerns you think you may have it, best to go get it checked up.
Yes, sir.
All right, well, thank you, Doctor. We appreciate you joining us.
Thank you.
All right, stay tuned for more right here on HTV.